Good evening, everybody. I'm attorney Chris DeBerry. Welcome to another edition of my weekly presentation where I present legal topics and topics that are related to personal injury and those affected by accidents, whether they be motor vehicle accidents or premises liability accidents, slip and falls, and the like. If you like the information that you hear today, please smash the like button. Feel free to share and comment below. We appreciate your comments and your feedback. I often dedicate entire segments of my show toward your questions, and it's very important to clarify some things for you. And there's a lot of information, a lot of things you got to know. So that's what we're here for. This evening, we are lucky to have with us a special guest. We're going to be interviewing Dr. Doug Arvanitas of Pro Health. Doug is a veteran to the personal injury realm, and he is a treating chiropractor in South Tampa. I'm going to bring him on now. Good evening, Dr. Doug. How are you doing?
I'm doing well. And yourself?
I'm doing well as well. It's certainly a pleasure having you on our show this evening. Thank you for taking the time.
Well, thank you very much. Honored to be here.
Of course. Well, tell us a little bit about yourself and your practice.
Well, I'm originally from Warren, Ohio, a little town up there by Youngstown. Did my undergraduate at Ohio State and did my chiropractic school at Life University, what was now called Life University. It was Life College back then. Graduated in 97, moved to Tampa. I've been practicing since 1998 when we had our boards. So practicing about 22 years now. So, and we've been in the South Tampa area ever since.
What kind of clients does your practice handle?
Well, we handle everything from infants all the way up to the elderly, to personal injury, to wellness patients. My specialty is actually sports and extremities. So we do 22 different sports. We do probably pretty much just about as many pro athletes as anybody in the country. We do the NFL Combine, Major League Baseball, NBA, boxing, mixed martial arts. So we do a tremendous amount of sports.
So some very, very important people in the sports world entrust themselves to your good hands.
Yes.
Okay. People are worth a lot of money.
A lot of money, a lot more than I make.
Very, very good. Well, they trust you, and that's important.
Mm-hmm.
We're here to talk a little bit today about personal injury. And, as we all do in Florida, it's such an interesting topic and so politically charged. And sometimes it seems that the consumer kind of gets lost in the shuffle. But at the end of the day, and I tell people this all the time, the only obligation an injured person has under Florida law is to get themselves better, not let themselves get worse. And I guess that's where you come in. So tell us a little bit about how you handle, say, an accident case, of an auto accident.
Okay. And what you said exactly true. So the way we handle our accident cases are a little bit different. Like you were saying, there's a lot of clinics out there that all they're looking for is PIP. They just want to get you in, get you through as fast as possible, absorb as much of the PIP money as they can, and then leave you with your injuries and you're on your own. We don't do that at our office. What we do is the very first day you come in, you fill out all your paperwork. We implement it into our computer system. I do all my exams personally. I do not have an associate doctor do them. I get to know my patients. I get to know exactly what's going on with their injuries. I talk to them. I talk to them about their attorney if they have one at the time. I talk to them about what they are going to expect, not only with our care, but what they should expect throughout the entirety of their case. We talk about doing EMCs, which are very important, which we're going to discuss here shortly. We talk about the diagnostic imaging testing, which is essential to the case and what you need to help make that case. And then also, which would lead us right over into our next step, which is, do they need an orthopedic evaluation, a neurosurgical evaluation? What's the next step in their care beyond chiropractic if they need that? Then we manage the case. We get everything with their attorney. We manage the case with the patient. We make them very active in their care. We don't tell them what to do. We give them suggestions. We give them hints. We give them talk through everything with them, and we help them make educated decisions on what is the best course for them to follow. And then once we get through the whole course and we get them to where we need to get them, then we get all the records over to the attorney, and we work with the attorney to make sure that everything transitions smoothly and whatever the patient or the attorney needs at that time.
Now, Doc, you raised a very interesting point. You talked about some clinics do nothing but go through a client's PIP. However, personal injury protection reimbursement is a major. It's really the first line of defense for the injured party. You know, as you know, their insurance policy will provide $10,000 of funds, which will pay 80% of their medical bills at that rate, minus whatever their deductible is. So PIP's a very important part of what we do. Of course, it's not the whole shebang, and it's not something to just be gone through like some providers do. But there are some rules that apply to PIP, and some of them may seem a little bit unfair. What are some of those rules that you have to comply with if you want to avail yourself of your PIP benefits?
Well, that's where the EMC comes into play. So once you get involved in an accident, you do have $10,000 worth of benefits available to you, but that doesn't mean the insurance company is going to give those to you. What they do is upon an immediate accident, they will only grant you a quarter of that, or $2,500. Then at that point, when you go seek your medical attention, you either have to go to a hospital or a medical doctor or a DO, a nurse practitioner. They will do an evaluation on you. And if they feel that your injuries are such that you fall into what's called an EMC classification, which is emergent medical condition, which means that if you don't seek treatment, your injuries could become worse and cause you more pain and suffering and difficulties down the road. So if they deem you that EMC classification, then it takes your PIP from $2,500 to $10,000.
And $10,000 is what used to typically be the amount you would get automatically before the EMC came along.
Correct.
Okay. And how many days do you have to actually see a physician so that you can avail yourself of your no-fault benefits?
That's up to 14 days. So it benefits the patient, if you've been involved in an accident, to go seek attention immediately and make sure that you get that clock stopped as fast as you possibly can.
Okay, yeah, and that's very, very important. And folks realize that you have that 14 days, and while it's optional with the insurance company as to whether they're going to extend coverage beyond that date, I very rarely ever seen an insurance company accommodate one of its insureds who has shown up for treatment after the initial 14 days, and that's a requirement that they wrote into the statute in 2012. It doesn't make a whole hell of a lot of sense. It isn't it true, doctor, that a lot of the kinds of accidents people or injuries people experience most often are not necessarily the kind that are immediately obvious?
That's correct. There's the severe accident and the trauma that you know exactly what happened. You smashed your head against the windshield. You feel that. You know, I had a patient go actually through the windshield. So he had substantial injuries. He was not wearing a seatbelt. So then you have the ones that after you've had this trauma, it may take a couple of weeks for it to really show up. And in the past, they used to give you, I think it was a year or two, and they really didn't question it. And now if you took too long of a time, then they would start to question whether or not that was actually due to the car accident or not. But it really benefits the insurance company to add this 14 days in there, because if you don't go within 14 days, then they don't have to pay your claim. And obviously the insurance companies are a for-profit business, and that helps their bottom line.
So what's happening with the body? Suppose a person is involved in a rear end collision, and you hear of whiplash syndrome. Like, what's going on with the body? What's happened?
Well, it depends. Now, if you're at a dead stop and then you get hit from behind, your body's it's physics principles. So your body is in a state of rest and not in motion. You get hit, that whole vehicle, everything goes forward, which throws your head backwards at that time. Then your body rebounds and goes forward. Now, at that point, all your muscles in your upper back connecting up to your neck and your head and your occipital line, they're going to do what they're supposed to do, which is try to prevent your head from getting thrown forward. And they're going to contract. And once they contract, with the weight of your head and everything being whiplash, so to speak, now they call it an acceleration-deceleration injury. And at that speed, it can create a lot of damage to the structures, not only the superficial ones as the muscles, but deep down inside where you've got the tendons, the ligaments, the discs, and all those fibers in there. And it can really, if you slow that accident down and you watch how violent it is in slow motion, then you start to understand how much these injuries can affect the body.
And so these injuries, they don't manifest with bruising or bleeding or broken bones, do they?
It's some do, some don't. You have the obvious ones where we had someone get a fractured arm a fractured knee the other day. I got hit in the door, and his knee got pinned against the center console and tore everything in there. So yes, he had bruising, he had cuts, he had bleeding, he had swelling, he had all this. But now we're talking about soft tissue injuries, which is a little bit different. Let's say in the cervical spine or the lower back, And you don't see the bruising unless you've torn something in there. Then you'll definitely see the bruising. Ligaments don't bruise like that and are visible to the naked eye. Same thing with a disc. You can bulge disc, you can tear a disc, you can herniate a disc, and that's not gonna manifest itself in a bruising, a visible sign. It's going to manifest itself in the pain, the symptoms, the radiculopathy, the radiating pain down an extremity, the severity of the pain, all these different things, loss of functions.
Isn't it true that a lot of the injuries you could sustain that are soft tissue in nature won't necessarily be evident on an X-ray study?
Oh, that's correct, because the X-ray is only going to show the hard tissues. They show a tiny bit of the soft tissue, but it's primarily for the hard tissue. So you're looking at the bones at that point, where the MRI is going to show us everything.
What is an MRI?
Well, it's a magnetic resonance imaging, where instead of just using ionizing radiation, they put you in the machine and it uses the hydrogen ions, and it through the magnet, it lines those up, and it creates an image that you just cannot see. You cannot get with a traditional X-ray. X-ray is only it's like a shadow. So whatever it sees hard tissue wise, it's going to create a shadow onto that film. Where an MRI is going to show us everything that we need to see. It'll show the soft tissue, it'll show the hard tissue, it'll show everything, the discs, everything.
So would an MRI be helpful in helping diagnose a herniated disc or a bulging disc?
Yes, it's the gold standard now of diagnosing that. I can do my physical evaluation and have a really good idea that the patient has a bulging or a herniated disc, but I can't definitively say that's what it is until I get that MRI. And once I get the MRI, it shows us everything.
How often of the time do you find that you were right?
Well, I have a little bit of a background in radiology. So when I was going to chiropractic school, I worked for 2 years in the radiology department, where I got to do about 500 sets of films and sit with 3 radiologists and get a little bit better education. So I'm pretty much right. I'd say the high 90% of the time.
Wow.
Yeah.
That's pretty good. And what is ligamentous laxity?
Well, it's kind of like a rubber band. So your ligaments will hold the bone to bone, and they're there for a purpose. They hold everything together. And if that has been stretched, it's like taking a rubber band and stretching it. It loses its elasticity and it becomes longer and doesn't have the same structure as it did. So that's what happens with these ligaments. They get stretched beyond their traditional range of motion and what they're supposed to be, and they become very laxed. And that's a very damaged ligament at that point, and it becomes dangerous because it can cause vertebrae to slide back and forth on each other. And if there's enough damage to cause ligament laxity, there's enough damage to cause bulging and herniated disc or torn disc, or even worse.
Well, so if the ligaments are stretched out so that the vertebrae have nothing to keep them in place.
Correct. It'd still be in place, but it's going to move a lot. Let's put it that way. So it depends. Now, if let's say we tore that ligament, now we've got we refer that patient to an orthopedic surgeon or a neurosurgeon, and we get the evaluation from that, because they may be facing something as significant as surgery.
And if that's a necessary step, that's something that you would refer a patient out for.
Yes. When it comes to our cases and the way we do it, again, they fill out all their paperwork and we do the exam. And, I send them out for their EMC. The very first day we get them, and they schedule it within the first week if they haven't had one. So they get the EMC, and then within 3 weeks and 1 day, actually, I have them in that MRI tube so that it gets the inflammation out of there. The insurance companies like to use the old thought of a herniated disc can't fully present itself for up to 3 weeks after an accident. So if we get them in there 3 weeks and 1 day, then we can eliminate that. We're playing chess better than they are at that point. And I happen to find that out because one of my good friends used to be the lead attorney for Allstate, and he was telling me all of these things and how they approach their cases. So again, I have a little bit of hint there of how they approach them. So we have to be better chess players than them. So 3 weeks and 1 day, my patients are in that MRI, and we're seeing exactly what's going on. When they come out of the MRI, the MRI companies that I use, I get their readers on my computer, so I get their films within 30 minutes after they get out of the machine. And I can look at them at the same time the radiologist is looking at them, and I have a pretty good idea. We get the report back from the radiologist. I go over them with the patients. We answer all their questions, and then we make the referral to the proper doctor at that point.
And suppose like just a garden variety whiplash type of injury, how long would you expect with proper therapy before an injury like that would resolve?
Yeah, you're looking at 3 to 6 months.
Okay.
Now, the key that you just said there is proper, because there's a lot of clinics out there that don't do things the right way, that only are interested in the money, in the PIP insurance, and they don't treat the patients correctly. There are some really good doctors out there. There are some really good attorneys, just like yourself. There's some bad attorneys, but you have the best interest for your patient at heart. You want to make sure that they're taken care of. We do the same thing, and there's other doctors out there that do it pretty well too. But the key is for the patients, they need to go into whichever doctor they're going to, knowing that they have a certain amount of benefits. Okay. And they need to protect those benefits. It's like writing a check out of a checkbook. You have a $10,000 limit, $8,000 if you're going by the 80% rule. And if they have med pay, then they will pay 100%. But every time you do a treatment, you're writing a check out of that checkbook. When that check gets down to zero, or that book gets down to zero, you have no benefits left. So we tell our patients, we want them to question us. We want them to ask us, why are we doing this? Why are we sending out for this test? Why are we doing this? So that they're aware of everything that's going on in their case, and they're active in making the decisions in their case. So it makes it better for them overall. And if they ever happen to be at a different place where we're not at, if they move away and they get involved in an accident, they know exactly what to do wherever they go.
And doctor, anytime a patient comes to see you, they sign in at your office, do they not?
Yes, they sign in at our office. They actually sign out too. We have what we call a super bill, and it's all the treatments that we did to them that day, and it's dated, and they sign. So we have a log of every time they walk into the office.
Okay, so that way, when you're billing an insurance company, you're guaranteed to bill only the treatments that are performed and only the treatments that the patient's had.
Yes.
Okay,
we have different checks and balance systems in our system, between our receptionist to me to my office manager. We have different checks and balances in there to make sure that it's accurate 100%.
Excellent. Doctor, those are all the questions I have for this evening. I thank you very much for appearing and taking the time.
You're welcome. And just remember if your clients, they need to get to a credible doctor. And I emphasize the sports there a lot, because if we are good enough to work on multi-million-dollar athletes, the insurance companies know that. Insurance companies are not dumb. They know who the good clinics are. They know who the good doctors are. They know who the, and I want to say the Ascaris or 401 pain and things like that. But they have a file on every doctor, and they see us as a high-end sports clinic that we do some PI, and they leave us alone. They know we do it the right way. The insurance company has done something over the past few years. They'll go in and they'll do inspections into the clinics. And a lot of doctors refuse to let the inspectors in and make them come back in 2 weeks and make an appointment.
Oh.
Well, we don't have anything to hide. You want to come in? Hey, if I'm with a patient, give me 5 minutes and we'll go ahead and look at the clinic. So if we have nothing to hide, we'll let the inspectors in that day. So over time, they leave you alone because you have nothing to hide whatsoever. And they know that they can walk in my clinic anytime, and they get it's going to be the same thing every time.
Doc, somebody has a question too. Janet Myers from Zephyr Hills. I feel like Larry King. Janet Myers from Zephyr Hills asks, why is a CT scan ordered sometimes rather than an MRI?
Well, it just depends on the part of the body, and it depends if the patient has any metals in their bodies. Let's say somebody's got a plate in their skull. Well, you really can't do an MRI on that because the magnet, it'll heat that plate up. So it just depends on if it's soft tissue. Let's say they're looking at a possible bleed in the abdomen. A CT scan will show that better than an MRI will. So it just depends on the patient. It just depends on the situation.
All right, Doc, that's all the time we have this evening. Once again, thank you for appearing and sharing this information with us. And everyone, this is Dr. Doug Arvanitas from Pro Health in South Tampa. And I've worked many cases with him, and he's the best at what he does. He really, really is. And folks, I want to thank you all for joining us this evening. And if you like what you saw, feel free to smash the like button and comment and criticize, and I'll welcome it. And again, Dr. Doug, thank you very much, and have a great week.
Thank you very much for having me on. You too.
Absolutely.